Welcome to the Journal Editorial Report. I'm Paul Gigot. Well, the public option came back this week with a vengeance, with both Senate Majority Leader Harry Reid and House Speaker Nancy Pelosi unveiling plans that include some form of a government-run health insurance program. It's a sore spot for many physicians who argue that the government's involvement diminishes the quality of care they can give their patients. The American Medical Association irked many of its members earlier this year by endorsing a plan by House Democrats that included a public option. And next weekend, a dissident group of doctors plans to try to force the AMA to drop its support for the health care overhaul. They're introducing a resolution at the AMA's semi-annual meeting that calls the legislation crafted so far, quote, anathema to doctors and patients. Dr. Donald Palmisano was the president of the AMA from 2003 to 2004. He's the spokesman now for the Coalition to Protect Patients' Rights, a group of more than 10,000 physicians. Dr. Palmisano, welcome. Thanks for being here.
Pleasure to be on your show, Paul. Thank you.
Okay, now you've got the House and the Senate bills introduced this week. Should they pass?
No, they should not pass in their present form. Physicians, certainly the physicians that I work with, want to see health system reform. They want to put the patient in control, the right to buy across state lines, the right to own the insurance
across state lines, yeah.
And they don't want more government involvement. In fact, the AMA policy, I'm not speaking for the AMA, but I was there for many years. When the policy was passed, it says that there'll be no further government involvement in the practice of medicine, and the goal is for people to own their own policy. The goal is for people to get tax credits and for people to be the decision maker with the physician as trusted advisor. These bills do not do that. They increase taxes in the long run, and they decrease availability of care for patients.
I want to get to the AMA a little bit later, but this public option idea is described by the people who are for it as Medicare for all or Medicaid for all. Why do some doctors have a problem with Medicare? It gets down to the question of reimbursements, does it not, for charging less, paying less than the actual service costs?
Yes. Well, first of all, government should not be in the business of price fixing. Whenever you have price fixing, what you get from recorded history is decreased availability of the product or the service.
But that's the way Medicare works.
Yes, that's the way Medicare works. But it wasn't that way in the beginning. In 1965, I make that point in my book on leadership. In 1801, Section 1801 says no federal interference in the practice of medicine. And then later the government said, oh, well, that's where we started, but we soon have to change. So physicians don't have a lot of confidence that what passes in these giant bills will be followed. In fact, they are concerned that some things will be followed that will destroy liberty. And the second thing is, the things that look good will be removed from the bill later.
So you think that if this passes, those price controls that are now part of Medicare will spread throughout the insurance system and the practice of medicine? Do you think that is going to actually affect the quality of care?
Absolutely. It doesn't matter if you have insurance if you can't find a doctor in your hour of need. Everybody can have a Medicaid card, but what good is it if there's no longer a neurosurgeon in your community? What do you do if you have a Medicaid card and you have a patient, a physician who treats Medicaid patients, but no longer can stay in the practice of medicine because the cost of delivering the service is more than the money received. And so you lose those individuals and you end up with long lines and rationing. We have examples, Great Britain, we have Canada. I just got back from Australia where I lectured on my book, and in Australia, the government is giving a subsidy to people who buy private insurance, 30% subsidy, and people can pay the difference, the gap. We could fix the problem if government messes it up even more by saying patients and physicians have the right to privately contract.
If you take Medicare patients and I want you to do my surgery and they're only paying 80%, of Medicare is only reimbursing you 80% of what it costs, and I say, you know what, I want you to do it, I'll pay you 110%. You can't take me as a patient. I can't
do it unless I can privately contract, and that's where they come up with this, oh, you can privately contract. Well, you can, but you're kicked out of Medicare for 2 years.
For 2 whole years. And you can't take any other Medicare patients.
Right. And you, the patient, you're not allowed to receive any money from the government for that particular service. I call that coercion. I call that something that's akin to un-American activity.
Well, it interferes with my choice to be able to choose the physician.
Absolutely. The hallmark of the free enterprise system is the right to properly contract, and they destroy that in these bills.
All right, let's talk about the AMA.
Yes.
Your former colleagues there, they support this, and they support this, I guess, because they say we've done a deal with Congress that's going to get back a higher reimbursement rate. What do you think of that deal?
Well, certainly I came out early on and told the AMA I think that was a serious mistake. I think the AMA is a wonderful organization. It does much good. And I like the people who are in the leadership of the AMA. But they made a mistake. Anybody can make a mistake. But when you make a mistake, what you ought to do is acknowledge you made a mistake, and you ought to say, what can I do to fix it? One thing they can do is remove their endorsement. They say it's not an endorsement, it's a support. Well, let's not get into Humpty Dumpty type language with Alice. You know, the words mean whatever I want it to mean whenever I say it. And that's what the government does. I mean, now we have Speaker Pelosi calling this, you know, the consumer choice or some other name. The name changes every week. Why do that? What it is a government plan with coercion and taxes, and it removes the choice from the patient.
But the AMA would say, look, you want higher reimbursements, we've got them for you. That's what we've negotiated. Isn't this good for doctors, particularly primary care physicians?
Paul, if you and I are in negotiations, I don't want to let you I don't want you to frame the argument, because I'm going to lose. So what the government has said, we have you in a small cell and we have shackles on you. So here's the deal. We're going to give you some more money. We're going to get rid of this horrible price-fixing formula, you know, jargon, sustainable growth rate formula connected to the, you know, the gross domestic product, all that jargon. What it means is they price fix. So now what we're going to do is we're going to wipe out the debt. We should cut you 20% now, and a little later you'll be up to 40% cut. What we're going to do is change it to another formula. The premise is wrong. You government, my government, do not have the right to set my fees.
Right.
You see, in other words...
So you think the AMA is kidding themselves, and they may cut a deal now, but 5 years down the road, 6 years, whatever, the politicians will come back and say, we're going to cut it anyway. Is that what you're saying?
Well, it's going to end up as a loss for the patients and the physicians. What AMA needs to say is, look, whatever you do, first of all, we want to take care of the patients, but allow us to properly contract with the patient. And don't forget medical liability reform. When I was president of the AMA, it was our #1 priority. And private contracting is among our highest priorities. The public option, the government option, is really a government takeover of medicine. It will destroy medicine. You could write a bill with about 10 pages. Buy across state lines, allow people to own their own insurance, encourage health savings accounts. Those things are going to be destroyed with these bills.
All right, Dr. Palmisano,
Yes,
thanks
sir.
so much for being here. Still ahead, a nervous White House gears up for Tuesday's elections, but has the spin already started? What the governor